So for my neuro assessment, I would first knock on the door before I entered the room. I would wash my hands as I entered the room and I would introduce myself. Hi, my name is Abby. I'm going to be your student nurse today. I'm just going to do a quick neurological exam on you. It should take no longer than 10 to 15 minutes. I would ask them their date of birth, name and date of birth, so two identifiers. I would check that against their wristband once I have them confirm their name and date of birth. I would ask them if they're having any pain at the moment, if they experience any headaches, any random spells of dizziness, stuff like that. Assess any allergies, if they have any allergies. Before I start my exam, I would just kind of, as I'm having a conversation with my patient, I would just, make sure that they're answering all my questions correctly. Pay attention to their speech. It's nice and clear. They have a good tone. They don't come off as if they're angry or upset. I would ask them, to get their orientation, I would ask them their name, where they are, what like a current event like COVID going on, what time it was, and then as I am talking to them, I would also check for how alert they are, if they're able to quickly answer my questions, or if they are a delay in their conversation, they aren't as oriented. I would check their posture as they're sitting, just to see if they have any slouching or any discomfort, or if they're nice and erect, talking to me, having a good conversation. After I am done, just doing my assessment, getting their history, I would go on to the actual exam. So I would assess all the 12 cranial nerves. So the first one would be the olfactory nerve. I would have source of aroma. I would have like coffee grounds or soap or something like that. Then I would do the ocular nerve, which would, I would do the Snellen test. I don't have a Snellen chart, but I would have them close one eye and tell me the Snellen chart. For the ocular motor, I would go ahead and check their pupils with my pen light. So just check the if they're equal, if they're round, accommodate to the light. They react whenever I shine my pen light into their pupils. For 3, 4, and 6, I would do the cardinal direction gaze. So I would do 6, have them follow my finger out and down, but I would do it slowly, and I would have them just follow my finger just to check the muscles in the eye to see if they can follow my finger. For the trigeminal, I would do check their jaw muscle. So I'd palpate their jaw and have them kind of clench their teeth down and just kind of palpate and see if all that is intact. Just have them clench. For their facial nerve, I would have them smile, frown, kind of move their eyebrows up and down, kind of frown, and they can smile, just to check all the muscles in their face. For hearing and balance, I would do, if I had any suspicion that they had hearing loss, I would do the Weber test and the Rhine test with my tuning fork. So I would strike it, hit it on their head, and if they can feel the vibrations go to the ears, that would be the Weber test. And then I'd strike the tuning fork, hold it out, have them listen. And then put it on the back of their bone there. And then if they have more vibration in their ear than in their mastoid, then they would have a positive test. I would also do, for their balance, I would have them do the Romberg test. So they would stand up with their arms to their body, and I would have them close their eyes for 20 seconds. And if they don't have any swaying or anything, then they would have good balance. For the glossopharyngeal nerve, that would be their gag reflex. So if I had a tongue depressor, I would just stick it in there and have them stick out their tongue if they or and just watch their uvula move up and down just to see if they have like an appropriate gag reflex. For the spinal accessory, I would hold resistance on their shoulders and have them kind of shrug their shoulders, just to see if they have really good tone in their shoulders. And then the hypoglossal, that would be movement of their tongue, like strength of their tongue, and if they can move it, and obviously if they're talking to me, they have good strength in their tongue. For the other senses, I would have my cotton swab, and then I would have my Q-tip with the sharper end and then the dull end. I would check sensation. I'd have them close their eyes and just have them like light touch on their forehead, their cheek, their chin, kind of down their upper extremities and then their lower extremities, and let them tell me whenever they feel it. For the same thing with my Q-tip, I'd still have them have their eyes closed, just press, kind of like switching between the dull and the sharper side, between their face, their upper extremities, all down their arm and all down their leg, and have them identify whether it is sharp or dull. For the other two tests, I would have them, I would probably have like a key of some sort, and have them close their eyes. I'd place it in their hand, and I would have them identify what the object is. For the other test, I would also write something on their hand with my finger when their eyes are closed, and see if they can identify that and tell me if they can feel that. When I'm also checking for the strength and the tone of their upper body and lower body, I can have them hold their arms straight out with their eyes closed, and I have them do that for about 20 seconds, and I would just observe them, just watch them to make sure that their arms don't fall. I would also have them do that with their legs straight out, and also watch again for 20 seconds with their eyes closed to make sure that their legs don't fall or drift down. For their reflexes, I would check the bicep by, I would probably place my thumb or 4 fingers, probably my thumb, on that tendon right there. And then I would use my stethoscope or sort of like a harder object and just kind of touch lightly with on my fingers, and just watch the arm kind of react as a reflex. That would be the bicep. The brachioradialis would be about 2 inches up on the radial nerve, and again, place some pressure on that and then strike it, and then see a little bit of a reaction of the thumb. Tricep, I would put some pressure right here, or a little bit above the elbow, and then strike it again and kind of watch the arm jerk. Patellar, I would do right underneath the knee here with a hammer, a rubber mallet, and watch the patellar reflex. The leg will jerk a little bit. And then for the Achilles, I would do it right behind my ankle as I'm kind of holding up the patient's leg when they're laying down, and just kind of jerk it, and their foot would jerk a little bit. So after doing the full physical, I would inspect, make sure they're alert and oriented, check all the cranial nerves, the muscle tones and strength of their body, the senses, make sure the facial senses and the arms, upper extremity and lower extremity, they can feel. And then for the reflexes, I would finish with the reflexes. So after I'm done with the full exam, I would ask my patient if they're experiencing any pain, if they still are comfortable, you know, not experiencing any dizziness, anything like that before I leave the room. I would thank them for my time, ask them if they have any questions for me. Before I would leave the room, I would make sure the bed is at the lowest point. If needed, I would have 2 guardrails up just in case if they were unstable, they might roll out of bed. I might have that. Make sure the bed's locked, so if they need to get out of bed, then that bed won't roll. And then if they're in need of their call light, they're within reach, so they can easily reach that. So once I make sure all those are checked, I wash my hands before I leave, and then I step out of the room, and that completes my assessment.